Today we're talking about something really important. We're talking about prostate cancer. That is a very important conversation we have to have. Now, it's one of the most common cancers among men, yet many people do not really understand what exactly it is, what causes it, and how to even prevent it. And the truth is that most men don't pay attention to it until it's too late. It is so sad that that is the case. And I want to change that with today's discussion. We'll be looking at what exactly prostate cancer is, the risk factors, the signs you shouldn't ignore, and the lifestyle choices that can actually help you reduce the chances of getting that. And joining me this morning is Dr. Isaac Mensah. He's a medical practitioner and an adjunct lecturer with Radford University. And together we're going to break everything down and hopefully make this conversation one that encourages men to take their health seriously. So, Doc, good morning. You're welcome to the Business Breakfast on Z.
Good morning, and thank you for having me.
Right. Thank you so much for also making time. We're really grateful.
You're welcome.
All right, Doc. So to begin with, what exactly is prostate cancer, and why is it such a major health concern for men, especially as they grow older?
Yes. So prostate cancer, there are two different words, so we need to break them down to see.
Sure.
When we say prostate, it's an organ found only in men. It's found only in men, and it is an organ just below the bladder. Now, what does it do? It secretes fluids which mix up with the semen. Some of these fluids are nutritious to the sperm. So during sexual intercourse, the ejaculation process, the prostate glands come into play to secrete fluids, which acts up to the sperm to form the semen that we see, and it sets up nutrition for the sperm as it goes along the way. So it's just below the bladder, which is our urinary tank. Okay, so that's prostate, and it's not only in men, so that makes men vulnerable to prostate cancer. Another thing is that the word cancer itself, as we all know, is abnormal growth of cells, abnormal growth of tissues in the body, and it is not just the abnormal growth of that tissue or that cell, but the ability to spread to surrounding tissues and other parts of the body. That makes it dangerous, and that makes cancers difficult to deal with if you don't track it early. Just last month, we finished with breast cancer, so I'm happy that we are coming up with prostate cancer for men. So that is when the two words come into play, prostate and the cancer. So women don't have prostate cancer. It is common in men also because of our androgen level, which we call the testosterone. The testosterone is known to drive or fuel the growth of the prostate cells. So when you have high levels of testosterone in your body, there's a high risk of the prostate cells becoming cancerous. So notably, men have it because of our testosterone level. It's common in the elderly, but nowadays we see people even less than 40 with prostate cancer.
Really?
But the cutoff, let me say 45 to 50 and above, have a higher risk of having it. Why? Because at that time, you are aging, and as you are aging, your tissues become weaker. There's risk of fibrosis. We call it fibrosis. They are becoming scarred. The tissues are undergoing scarring because of your aging process. So it's more common in the elderly because of that aging, and then the fibrosis process that their prostate glands goes on. And also the hormone levels comes into play. As you are advancing, your testosterone levels rises, and that puts you at risk because it drives the growth of the prostate cells, and they can become cancerous. So that is a bit of introduction to our discussion.
Right. Great. So you said the prostate is located where?
Below the bladder, that's the urinary tank.
Okay.
Below the bladder. Yes. So when you are tracking the genital system in men, when it comes all along from the testicles, that tube just junctions at the bladder, and that junction is where the prostate gland is. This is an organ just below the bladder.
And it helps produce semen.
Yeah, it helps produce fluids that are nutrient sources for the sperm.
Okay.
Yes, so the fluids are nutrient sources for the sperm. The sperm comes from the testicles and the balls down there, but as they are coming, they need to be fed, they need to stay alive. So the prostate glands produce this fluid that mixes up with the sperm and then comes out of the semen. Yeah.
I see. So what exactly causes the prostate cancer? Is it purely genetic, or there are some lifestyle choices that also play a big role?
There are genetic causes which come as a result of mutation. All right, so mutation. So when there are mutations, it can be transferred genetically. Then you have the lifestyle choices as well. And then, like I said, aging is also a factor. But as you are aging, your tissues become more weaker. The fibrosis nature of the prostate gland puts you at risk of it. And then we have a race. Sometimes race also comes into play. The black race. It's known that the black race also have a higher risk of developing. So these are risk factors. Come again.
Why is that so?
Because of where it was noted first. I mean, in the black race. So the cancer was noted more common among the black race. So that means the mutation happened more genetically across that group of people. So you and I are more at risk. And in medicine, when we see something at risk, that means you have a higher chance of having it. It doesn't mean that 100% you have it, but your chances of having it is higher than somebody who is not at risk. So that person at risk. Then when in your family you have a direct relation who has also had it before, your granddad, your dad, your uncle, then your risk is also higher. So that also puts you another higher risk. So these are the factors that people consider. And they know that, hey, this issue in my family, I need to be careful of it. Then you have a lifestyle. You have a lifestyle also that plays a role. So it's more of a systemic, combination of other factors that bring it about. But somebody might not have a family history, might not have anybody who has it before, but might develop a prostate cancer. Yes, because of the lifestyle as we're talking about. That alone will also be a risk for you.
I see. So what lifestyle choices actually makes us puts us at risk?
Now we are preaching about healthy lifestyle. Healthy lifestyle, what you eat. You see, what determines you as a personality is what goes into your body. So what you eat is basically, hello?
Yeah, I'm with you.
All right. So what you eat is basically what determines what your body, comes out with. So consumption of red meat, consumption of a lot of high-fat diet, saturated fat, which are the cheese, the margarine, most of the fat, the plant fats are the best. Sunflower, avocado, oil, and the rest. But when you consume a lot of the animal fat, they are mostly saturated fat, right? Red meat. You go and buy pork, you go and buy all the chicken, and then they are all not healthy diets for us. All right, a lot of cheese in our diet, but we don't consume the fruit and the vegetables that would be more healthy to us. And then excessive weight gain. You eat late, you don't exercise, you don't shed the fat you have deposited at night. 10 p.m., 11 p.m., you go and buy Indomie, but then during the whole week, you don't do any form of exercise. So all these things are going in, they are feeding into your cells, and your cells will begin to grow abnormally, and then they'll give you all the symptoms. So our lifestyle is very important when it comes to this chronic condition.
I see. Very, very interesting. I'm sure people listening to us are picking a thing or two. Now, Doc, there's often a myth that I hear people actually say that sexually active men are less likely to develop prostate cancer. Is there any medical truth to that?
There is no medical truth in the sense that there is no conclusive, research that has come to it. All right, it is a myth, as you are saying. So what goes into the myth is that we know the prostate gland. Whenever you have sex, you ejaculate. Prostate gland plays a role because it secretes the fluid that adds up to the sperm. So, and while the prostate gland is secreting the fluid, there's a saying, or that's a myth, that it goes along with other harmful substances in the prostate are all secreted along with it. So it assumes that the more you ejaculate, the more you are excreting the harmful substances in the prostate, within the prostate cells. They secrete all these things within the prostate cells, and then they just add up to the semen and then comes out. So it is more, advantageous as you undergo the ejaculation process. In some say more than 20 times in a month. Yes, but as I'm saying, there is no conclusive research to it. But we just, it it is something they've observed, and then looking at the theories of how the cancer growth comes about. Harmful substances in the prostate cells can also be cancerous. So as you are having the ejaculations and all these things are secreted, and they assume that there's a high probability that you are secreting this substance. But all in all, that is not only a factor for you to say I'm preventing prostate cancer. Your lifestyle would also play a very key role. Your family history will also play a very key role. So don't go around have ejaculating 20 times in a month and say, oh, I'm already protected against prostate cancer. No, you need healthy lifestyle, and you need to watch the things that goes into your body. Yeah.
I see. Thanks so much for clarifying that, because a lot of the guys these days use that as an excuse to do all kinds of things. And
if you are in your 20s, you are in your 30s, I mean, rarely. But when you are approaching your 40s, you need to be careful. If you are in your 20s, I mean, there are few diagnoses they make in the early 30s and the rest. As you are approaching 40, that one, you shouldn't be making these excuses that your sexual life will prevent you. You need to be actively involved. There should be active surveillance for the disease, not just the fact that you're having regular sex. Yeah.
All right, let me get clarity on this one as well. So are we saying that your lifestyle, right from when you are, say, your 20s or your 20s towards your 30s, is actually what will make you get this condition towards your 40s, 50s, 60s, or the lifestyle you live around that time that makes you...
Let me use weight gain as an example, right? So when you gain weight, you don't gain weight overnight. Weight gain, it's a process.
Right.
So let's say you are in your 35, you are in your 30, let me start with your 30. You have a good job. Your company gives you a car, you're driving around. You don't exercise. You have a good office, air conditioning. You don't exercise from car to your office to house. You eat late because you close late. You are living a sedentary lifestyle. So during your 30s, you don't see it. You close from work after five days. You go and sit, have a drink or two with your friends. You don't see it. You assume you are young, but it's a combination. So when you're approaching the 40s, all these things in your body are going into your organs. They are being deposited gradually. So I don't want to even switch our conversation to the kidney, but let's stick to the prostate. So if they are deposited in the cell gradually, because you don't even exercise to shed the late night that you have eaten, the alcohol you have taken, all of that. You don't. So at the age of 40 going, 5 years, 10 years going, then you start having organ damage. And these organ damages are what we are talking about as one of the causes, being one of them. So they begin to have abnormal growth like the cancer cells they are developing. They begin to undergo fibrosis. They begin to have damages, and then the failures to other ones also coming. So it's just an accumulation of a life. It's not an overnight thing. So it all starts from the youth stages.
Right.
So don't assume, oh, I'm 25, I can do whatever I like. By the time you hit 30, 35, you realize that your organs are started failing you, and the prostate is one of them. So those people, they diagnose it early in them. There are a few instances at 35, they diagnose prostate cancer. I have seen one before.
I see.
Right. And you look at that person, the lifestyle was very, very, very not advisable. So that is it. It's the things you take in, and it has also this smoking and the rest. Some of them contain cancer cells, nicotine and the like. So when you are in your youth stages and you are smoking, you are depositing this nicotine into your body. You get to the ages that put you more at risk, and then you develop it quicker because of your lifestyle, compared to someone who was exercising, eating healthy, very conscious of his lifestyle. Yeah.
So smoking can also contribute to that.
Yes. Sedentary lifestyle, smoking, alcohol intake.
Even alcohol.
Yes. Alcohol intake.
How does that work?
You know, alcohol. I mean, one of the side effects of alcohol is that it deposits in the liver, contributes to fat accumulation, and this that accumulates in the cells. As I'm saying, it then can lead to abnormal growth of the cells. The cells are not supposed to have those substances in them. Every cell and what they are supposed to do. So a prostate gland is supposed to have that secretion and the like. If there are other things deposited in it, they become harmful cell now sees it as a foreign body. It begins to overgrow, and that overgrowth will become an abnormal cell that will come as a result.
I see. Okay. Well, exactly 10 minutes after 9. This is Business Breakfast on Z101.9 FM. This morning, we're talking about prostate cancer. We're trying to understand exactly what it is, the risk factors, prevention, as well as the treatment plans that there are. And it's a very important conversation. Please do well to share the link with family and friends. We're streaming live on Facebook at ZFMGH and also on YouTube at Z Multimedia. Please visit those platforms. Drop a comment under any of the posts, and we'll also read them for you and get Doc to respond to them accordingly. You can also send us WhatsApp on 0544321019, 0544321019, and then we can read your messages for you and get Doc to respond to them. But you can call me on that same number, or you can call me on 030-3956641, 030-3956641. Then I give you the opportunity to share your thoughts with us this morning. So Doc, let's continue the conversation. But my guest is Dr. Isaac Mensah. He's a medical practitioner and also an adjunct lecturer with Radford University, and he's helping us understand all of these things. Doc, let's move to the signs and the symptoms. What exactly are some of the early signs or symptoms that men should never ignore?
Okay, so when we say the prostate itself, cancer is not the only thing that affects the prostate. The prostate can undergo infection like any other cell in the body. We have something called benign prostatic hyperplasia. It can become inflamed, can become swollen like any other cells in the body. Then it can also get the cancer as well. Most men under 35 normally face a prostatitis, which is infection of the prostate from normal sexually transmitted infections that can affect the prostate, because the prostate is in the pathway of the sexual system in men. So
Doc, repeat what you just said respectfully.
Yeah, so I'm saying that there are mostly three notable diseases of the prostate.
Okay.
Prostate infection, we call it prostatitis. Inflammation of the prostate, which makes the gland very enlarged, we call it benign prostatic hyperplasia or hypertrophy. And then we have the prostate cancer.
Okay.
In the youth, among the youth, 25, 30, 40 below, they normally get the prostate infection because of sexual, bad forces of sexual lifestyle. So when they have sexually transmitted infections, because the prostate is along the pathway of their sexual organ, you can easily trap the infections and the prostate gets the infection. We call it prostatitis. So these symptoms normally manifest. Common one is frequent urination. You and I have all had urine tract infection before. Frequent urination, pain during urination, right? You might start urination and then the urine will break and come again. We call it weak stream. We have dribbling. Then we have urgency. Urgency in the sense that if you feel like urinating and you don't get up quickly, you might urinate on yourself. So those are symptoms of prostate disease, right? But when the prostate becomes
Doc, sorry, just before that, so those ones can be seen when you are very young.
Yes. So those ones you can manifest it in your youth stages from a normal urinary tract infection or sexually transmitted infection. Yes.
Okay.
So the prostate which is along the urinary or the genital system in men can track all these infections when you get them. So and the causes are the same as the lifestyle choices and all the things we've talked about, right? No. So this one is an infection. So it's normally from bad sexual choices. So having unprotected sex with somebody who has an infection, you are predisposing yourself. So you get infection. Using a washroom that is not well cleaned, you can get a urine infection, and the prostate can get infected as well.
Okay.
So these are infections you get in daily life. But when it becomes a cancer, there are some specific things that you exhibit. So if you are having the infection symptoms, doesn't mean you are getting cancer. So that's the difference you should know.
Okay.
Yes. So the fact that people will say, "Oh, I'm urinating frequently. Am I getting the prostate cancer?" No. I mean, you might be 60 years. You are urinating frequently. You urinate within short intervals. Sometimes in the night you urinate more than 3-4 times. All this might not specifically point to prostate cancer. You need to be screened, and then we pick up the particular reason for your symptoms. That is what most people are getting wrong. But when it becomes cancer, there is something specific that you see. One, you might see blood in your urine. Most prostate cancers present with blood in the urine. The same as urine infection. Some urine infections also present with blood in the urine. So how do you know the difference? Go and see your doctor. It's a doctor who is in the best position to tell you. But when you see blood in your urine, then you wake up, then you begin to get to the herbal doctors. Then, I have prostate cancer. No testing, no examination, nothing. Then you put you on prostate herbal concoction. Meanwhile, it might be a urine infection that you have.
Right.
So you need to be very, careful with the symptoms you're having. So blood in your urine is specific to prostate cancer. Then you might even have blood in your semen. As I said, the semen secretion comes along through the prostate. And when it's cancer, you might deposit some blood into the semen and might come out blood in the semen. So these are the things that you might be having. Most people see blood in their semen and they think, it's a normal UTI. Let me go and buy antibiotics. But you can't make that decision. Let the doctor make that decision for you. Right. Then when the cancer begins to spread, the final one, when it begins to spread to your organ nearby your prostate or to your hip, to your backbone, then you begin to have hip pain, back pain, and then cancer comes with a weight loss. Then you begin to lose weight. Unexplained weight loss. You are eating well, but you are losing weight. So with this one, we always have to go to the doctor for him to make a diagnosis. So that might be the early stage of the cancer. And if you don't take time and track it well, it spreads, and then it becomes difficult to manage.
I see. Doc, how can one tell the difference? I mean, you talked about urination. I just want us to, I want to ask a follow-up question on that.
By symptoms alone.
Say again?
You mean a difference between the diseases by just the symptoms? Is that what you're saying?
No, mainly the normal. So I know that when people are aging, they normally have some urinary issues.
Yes.
Yes. I want to know the difference between that and possible prostate problems.
Yes. So if when you are aging, let me use a man as a gender. When you are aging, we know that your prostate has a risk of becoming cancerous or becoming enlarged.
Right.
But so you have symptoms. I mean, it's very common that you have it. But what I'm trying to say is that not every symptom pertaining to your urinary system is from the prostate cancer as you might think. It might be just a normal prostate infection, or it could be from even the urinary system infection. So don't sit at home, diagnose yourself, and then go to a nearby herbal shop to go and buy medication because you think you're having a prostate problem.
Okay.
Let the doctor do the diagnosis, because there are a lot of steps they undergo to make a final diagnosis that you have a prostate enlargement or a prostate cancer.
What? Sure, go ahead. Yeah. Sure, go ahead.
The two are different. Prostate enlargement and prostate cancer are different. They are managed differently.
Okay.
So if you don't know just by your symptoms, and they will all give you similar urinary symptoms. The same frequent urination, dribbling, weak urine, straining. If you don't take time, you have to go quickly to the washroom to go and pass your urine because you might urine yourself. They might all give you similar symptoms, but you cannot make that difference by just the symptoms. You need a health provider, a doctor, a urologist to make the decision for you.
Okay.
And by examination and assessment. Yes.
So mainly the main symptoms that you should be looking out for, I mean, or if you begin to see, you will know that you have issues.
The problem with your prostate are the common frequent urination, straining when you're about to urinate, urgency. If you don't hurry up, the urine will come on you. Sometimes by the time you realize the urine might even spoil yourself. Urinating more at night, more than 2 times at night. And then when you get to the cancerous stage, you might see blood in your urine or blood in your semen, as well as this loss. So those are the specific symptoms. But the decision doesn't lie in your hand to make a final diagnosis. See your doctor
to know that. Doc, I understand there are screening opportunities. I mean, there's room for screening.
Yes.
I don't know whether do they cut across all the hospitals in this country?
Yes.
Can people just walk into any of them?
Yes. So it's standard. So any symptom you have, You go to your health provider and ask the standard of practice. They always start from the history taking. So they take your history. The history might revolve around even your sexual lifestyle. So I want to pick what exactly is happening, because we know there are other things that can cause your symptoms. So we pick all those histories, and then we finally tailor it down to the one final diagnosis. And that final diagnosis is dependent on the labs that we do. So we have screening tools. We normally, every doctor, when you come with this symptoms, will always do a urine test for you, urine routine analysis.
Okay.
So we always do a urine routine analysis for you, so as to make sure you're not dealing with just a normal infection. So we do a urine routine analysis. Then we will examine your prostate organ. We will touch your prostate organ. We will do something we call digital rectal examination. We would examine and feel your prostate organ, because there are differences in the texture of the prostate organ when it is normal, when it is swollen, and when it is cancerous. The tests are different. So every good doctor would examine your prostate organ for you. Then we have blood tests that we do. We do the blood test. We call it PSA. So we do the PSA, and then we can know the level of the prostate disease that you are having.
Okay.
All right.
Right.
Most doctors will also even do a prostate scan. After feeling the prostate organ to feel the texture, they want to do a scan to measure the size. So it's sequential.
Okay.
It's sequential, yes.
Doc, so you talk about PSA. I'm going to come to you so you could explain that a bit for us. But at what age should men start getting checked?
I would think after 35, start doing your prostate specific antigen. Yes, after 35. Yes.
Okay.
Some. I know some 30 years even work to my clinic and want to request to do it because they have a positive family history. See, if you have a family history, that puts you at a higher risk. So that will make you be more careful.
Right.
So once you heard that his granddad died of prostate cancer, his dad has been diagnosed of prostate cancer. Even at 30 years, he's very cautious. So he will work in and he will be doing annually PSA check, which is very, very recommendable. I mean, yes, how much is the PSA? I mean, 1 year, if you start doing to see for yourself, 1 cedi a day, by the end of the 12 months, you can get money to do a PSA. So if it's something you want to do annually, it's achievable and commendable.
But how much is it?
PSA, 100 cedis, 120, 150, around that range, you can get it.
And how often should you go for those tests?
Yes, so I'm saying that if you are at risk of it and you are less than 40 years, one annual yearly is fine. All right. If you are 40 plus, you can do it every 6 months. If you are 40 plus, approaching your 50, you can do it every 6 months.
Every 6 months. Okay.
Yeah, but with a positive family history, don't sit down and be told before you go and do it. You have to be doing it often. Yeah.
Okay. So Doc, kindly tell us a bit about explain the PSA and how reliable it is in even detecting prostate cancer.
So the PSA is we call it prostate specific antigen. It's a reflection of how the cells, the cells function in the prostate organ. All right. So there are a lot of things that can happen to the prostate, and the prostate organ would overfunction. And when the prostate organ is overfunctioning, it's overworking, the PSA level would rise. They produce some certain things, we call them antigens. They are factors, we call them antigens, that will rise in the blood level. Okay. And the cell function would go higher in the prostate gland from causes like infection, inflammation, and then cancer. So these three things can cause your PSA level to rise. So when you have a prostate infection and I do your PSA, it can go up. When you have a prostate enlargement, we call it DPD, I do your PSA, it can go up because there is overworking of the prostate cell, and that will produce the oxygen in the blood for it to be tested. If I do a prostate PSA test for someone with cancer, it's going to be high. So how do I narrow down to the one who has the cancer? We have something we call biopsy, a prostate biopsy. So that is the final straw to diagnosing prostate cancer. You have the biopsy. So you do a PSA. So the sequence starts from you bring your symptoms, doctor picks it up. Doctor rules out other causes of the prostate problem. He do urine test, everything is fine. He comes to do a PSA. PSA is high. Now he has some other things that can cause high PSA. So for him to narrow down, he do a biopsy of the prostate. Where biopsy means you go into the body, take a tissue of the prostate organ, send it to lab for it to be observed under the microscope to see how the cells are behaving, how the nature of the cells, if they are the normal cells or abnormal cells. And that one, we call it seeing is believing. You have seen it directly under the microscope that the cells are behaving abnormally.
Right.
So you can claim that cancer.
Okay, Doc, I know you have to leave us very soon.
Oh, let's go.
Oh, okay. All right. So let's talk about prevention. Yeah. What are some practical lifestyle changes that men can adopt to lower that risk?
Yes. So when we come to factors that can cause, let's tackle it with the factor side. So factors that can cause prostate cancer, let's divide that into modifiable and non-modifiable factors.
Okay.
So when we say something can be modified, you can do something about it. So modifiable factors, which are risk factors that can lead to the prostate cancer. Common ones are the lifestyle behaviors, which I mentioned: smoking, alcohol intake, eating late, lack of exercise, unexplained weight gain, consumption of fat, and then red meat. All right. So you can do something about it. Yeah. So this is what is started as individuals. The other ones like aging, race, family history, you can't do anything about it. I mean, your dad has had it before, it's genetic, it's in your blood. You are aging, we are all aging. So no one can reverse aging. We are all of the black race, nothing you can do about it. So let's go and tackle the ones we can do something about. So that's our life. What you eat, you should be mindful of what you eat, what you consume. We are in the new stages now, but like I said, it's an accumulation of what you are doing now. That 10 years time, you will get a ripple effect. So you are in your 40s, you are enjoying all the red meat, eating late at night, smoking, alcohol. You get to your 50s and your small pension money, you will now be going to urologists to be doing tests for prostate cancer because your lifestyle, you're not watching it when you're young. So let's watch our lifestyle. Avoid smoking. Avoid alcohol intake. There is no advantage of taking alcohol. Nothing comes from alcohol intake. Your body would handle its normal metabolism without alcohol. Eating late at night. Why should you do that? I mean, if you are hungry in the night, just get some vegetable salad, something light, and then you go your way. Because after eating, you are going back to bed. The food is not going to be utilized. It's all going to be converted to fat, and fat will be deposited in the cell, and then this will abnormal group of the cells in the tissue. You are accurate. All right, exercise, very, very important. Like I said, as you get into the 30s and 35, you begin to to get managerial positions. They begin to give you cars, big house. I mean, you are living good, sedentary lifestyle. But don't forget that you need to watch what you eat and exercise. So every day you drive to work, you might even have a driver who takes you in and out. So what time have you made for your body? What time have you made for exercise? You can do that for yourself. Days you are up, do that for yourself. Some people don't even dance at church on Sunday. Dancing is even a form of exercise. You get my point?
Yeah.
Yes. But you are eating late and you are consuming all this unhealthy diet. Canned food, foods that all full of preservatives, you are consuming them. Why don't you go to the natural way, natural fruits and vegetables, and let's stay away from the canned food and the additives.
I see. So
yeah.
So
most of these foods contain carcinogens. These additives, they might be carcinogens. When we say carcinogens, it might lead to the growth, it might forward the growth of the cells to become cancer. Yes. They might be passed by FDA, be put in the system for you, but the more you consume them, you are risking yourself.
Right.
Yes. Yeah, you can go ahead.
I see. Yes, right. So are there specific like nutrients that are known to support prostate health, and even more specifically, even are there foods that we eat in Ghana that actually can support?
So let's just stick to our greens, our vegetables and our fruits. Our cucumber, our spinach, our consume, our fruits like orange, watermelon, the natural fruit. Let's try and stay away from the canned ones with everything and additives. Let's go the natural way. So if you want to, if you are advised by a doctor, consume food, don't go and buy food that has been processed, and take the natural one. Well washed, you're taking your time to wash it well, and you are good to go. You are preparing, vegetables for meals. Make sure you just clean it well, and you are good to go. Let's stay away from the processed foods all the time and consume the natural ones, which we always do. Yeah. So it's very healthy when you are consuming the fruit and the vegetables directly, and then your meals contain more of the raw tomatoes, cabbage, carrots. Yes, it's good. You are done. You take some fruit to as a form of dessert. It's commendable. All right, let's stay away from the pizza and the shawarma and they look appetizing, but they might not be nutritious.
Right.
And healthy for us.
So we need to check the food stuff we eat if we want to save ourselves or prevent any prostate issues, right? Another thing I want us to talk about is the treatment. Maybe there's somebody listening to us who has already gotten in there and all of that. So suppose a patient is diagnosed, what are the main treatment options available today?
Yes, so the treatment options are based on the stages of the cancer. Like I said, cancer spreads. That what makes it dangerous. It doesn't only stay within the cells, it spreads the tissues around it and then other parts of the body. So the treatment options are based on the stage of the cancer. Early stages, they might take away your prostate, we call it prostatectomy. They found it early. That's why it's very important to go early. When you go early and it is just within the prostate organ, they just go in, quietly take it out. Somebody might ask, well, when they take out my prostate organ, what will happen to me? Will I still survive? Nothing will happen to you. Your sexual life will go on. Yes, some will say after that you might not have erections, and it is not confessed. Your sexual life will go on. You might even be able to produce babies. It is not the prostate that is secreting your sperm for you. It is just a nutritious form of nutrients for the sperm.
Right.
So you might sexually active as everybody. And most of the time, most of these people that we diagnose them in the later part of their life, they are even done with their family. You understand? So every stages, you pick it up, you go and take out your prostate. Sometimes we do radiotherapy where we use radiation to destroy the cancer cells. So that's also an option. So we also do cryotherapy where they burn the cells with laser and other things. That is not at the early stages. So when the cancer has advanced, then that is where you put the doctor at a risk. And that's where you start hearing with social and so you have 5 years to live. You have 10 years to live. The doctor is not a prophet. He has seen and found out that a lot of your organs are all gone. It affects your kidney, affects your spinal cord, affects your lung, affects your... You get what I'm saying? So the doctor has seen that if all these organs which support you are done, what then becomes of you? So he gives you 5 years to live, 5 years more to go, and then you say the doctor has given you death sentence. So at the advanced stages, what we do is we do chemotherapy. Because advanced stages, when you didn't go and take out the prostate, it has already spread. Right. So what happens to the spread in the organ? You can't go and take the kidneys out. You can't take the liver out. You can't take the lungs out. So we do chemotherapy where you are infused with chemicals, medications, or you take pills that go all over the body to try and reduce the spread and then the effects of the cancer. So we have chemotherapy. We have also hormone therapy. Remember I mentioned the androgen hormone testosterone. So we give hormones that reduces the level of testosterone in the individual to prevent the growth of the cancer cells. So that's the advanced stage. So how would you want to wait to the advanced stage? When you're having the symptoms and you come quickly, you pick it up. But if you have the symptoms and you go and get your own concussion, and then you come after 5 years because the concussions are not helping you, when you come, the doctor has no option. Yes, you're giving him no option. He will only be managing you palliative. The palliative is to make sure you are living. So make a call because you can't do anything.
Can't do anything about it.
Yes. So it's better you come quickly as you are aging and you are getting all these symptoms. Let's not sit at home. Let's not just go and buy antibiotics and think we are facing infection. Let's come to the doctor, and the doctor little bit, but it's worth it. It's better you come and they say you have no cancer than you stay at home and the issue becomes out of hand.
I see. Okay. We have just about 25 minutes to the top of the hour. This is Business Breakfast on Z. If you just tuned in this morning, we're talking about prostate cancer. We're looking at we've looked at the risk factors, the prevention, and now we're talking about the treatment. My guest is Dr. Isaac Mensah. He is a medical practitioner as well as an adjunct lecturer with University of Radford, and he's helping us have this conversation this morning. You can join the conversation on WhatsApp 0544321019. Send us your questions, your comments, and we'll address them. 0544321019. And also you can call us on 0303956641, 0303956641. Also, we're streaming live on Facebook at ZFMGH and also on YouTube at Z Multimedia. Please do well to drop a comment on any of our posts and we'll read them for you. Okay, Doc, still on the treatment. Beyond surgery, and I know there's also radiation, are there new or less invasive treatments currently being explored?
Less invasive. So the hormone-therapy, I mean, it's hormones that they put in, they will infuse with hormones, and then they will go and decrease the androgen level in your body. So it is not invasive. All right. Then we also have the chemotherapy, it's medications in the form of pills or infusions. Okay.
Yeah.
But when all these options are explored and there is no any other option, they even want to take out your prostate organ, but they are left with no choice because it's already spread. Then they manage it palliatively, as I said.
Okay.
So yeah, the less invasive methods they are best when you go and report in the early stages of the cancer.
I see. Now, I realize that you're trying to debunk the fact that you won't be able to have sex after that. After the...
Oh, yes. It's also a myth. It doesn't mean that if you take out a prostate organ, you have erection.
Okay.
Right. But the prostate doesn't cause erection.
Right.
The prostate gets secret fluid that makes the sperm nutritious along its way. Right. But I mean, erection is a mental state, and erection also comes from nerves that puts power into your organ. So that is the erection pathway. All right. So if you have diseases that affect your nerves, diseases that affect your mentality, just psychologically, it's fine. But it doesn't. There is no direct link that if I have a prostate disease, I will not have erection.
Okay. But what are some other side effects that people should know?
From the surgery, from the treatment, or from the disease itself?
From the treatments and the surgeries as well.
Yes. So they take out your prostate. Like I said, you won't. If you are not lucky, and it is in your reproductive age, okay, that means the prostate is out. Whenever you are ejaculating, your sperm will come without the fluid that will provide its nutrients. So the risk is that there's a little chance that it might affect your reproduction, because if the sperms are not getting nutrients along the way, they might die. But the sperms are too many for all of them to die for you not to be able to get a woman pregnant. We think it's about 6 million of sperms during ejaculation. So I mean, definitely there should be some that would give fertility. So it is not something we are worried about. We are worried about your health, and then if the cancer is there, we take the cancer out. All right. Another thing is that, I mean, it's a procedure. So it's a surgical procedure. I mean, after surgery, we know there is a scar that will be formed. There is a wound that will be formed.
Yeah.
So during the healing process, yes. So pain, the healing must be followed well. Make sure you keep properly. You visit the doctor regularly for checking of your blood level, checking of your infection level. If you fail to do that, you might develop infections, and then you might have complications from the surgery.
All right. I see.
So you might be close to your doctor during that process. Yes. But you urinate all right. Yes, you can urinate like everybody. Your kidneys will function like everybody. I mean, just the process that was taken out.
Okay.
Every normal process will go on. Yeah.
Okay. In Ghana, some men actually hesitate to talk about these prostate issues. How can we break the stigma and encourage some more open conversations?
Yes. So the media, you can help us as I've been today. There's something I am always. We make breast cancer. We give breast cancer a whole month. I mean, you understand, for
Yeah.
awareness. Why can't we also make prostate cancer a whole month? I mean, you get it. Yes, because prostate cancer is also killing our men and our elderly men. So why can't we also do that? And most of them are going to.
I think there is. Doc, I think there is. So I think September is actually prostate cancer month, but we don't make noise about it as much.
How vibrant it is like the breast cancer one.
Yeah.
How many people wear T-shirts and go onto the street and make banners? You understand? Dedicate programs for it. I mean, and then make men come to the screening facilities for free screening. When we do these things, it attracts the people to the facility. All right, maybe in September month, we are reducing a PSA test to 50%. Do you understand? If we do that, they will come and do the test. Okay. We are September month, free prostate cancer consultation. If you have any problem with the prostate, any urinary symptom, come for free consultation. I mean, when we do that, they will come. But if you don't do that, they'll rather go and spend huge sums of money buying other medications, concoctions, and then the disease has not been tackled. You know what I'm trying to say? And by the time they come to us, by the time they come to us, they have already advanced in the cancer stage. Because they went to other places and nothing can be done. They went to other places where they told them, oh, you take this medicine within 3 months, your urine will flow perfectly. They have already spent huge sums of money at this place. And they come to the hospital late. But if we advocate that the month of September, as you are saying, there's free consultation, free labs are 50% cut off for them, this and this and this. These are some of the advantages. The medications, we reduce, because there are medications for prostate enlargement. We reduce the price for them, they will come. So those are the advocacies we should be doing.
All right, Doc, just because you talked about the fact that, I mean, there is, I want us to also touch on, just briefly, maybe if you can, talk about the life. What is life like after the treatment process for people that are living with prostate cancer?
Yeah, so life after the treatment process. So that's your question, right?
Yeah.
Yeah, so like I said, once the treatment stage depends on what stage you had and then what treatment you underwent. So if you underwent prostate removal, prostatectomy, definitely you need to stay in close proximity with your urologist, because you had a cancer. Most definitely, there's a higher risk of spread. The doctor takes out the prostate gland, but he will always have to be monitoring you for possible spread. If he hasn't confirmed the spread, you have to be monitoring you for the spread. So 3 months reviews with him, 6 months reviews with him, checking of your blood level, because most of cancers destroy our HB. So when you have a cancer, your blood level normally drops. So they always frequently test your blood level, test your infection level, because the procedure was invasive.
Right.
Do a routine urine test for you to make sure you're not developing urine infections from the invasions that they did during the surgery. So those are the things. But there's normal life for you. Urine is going to be produced. Urine flow will go on. You can have sex. You can involve in sexual intercourse. You have ejaculation. Just that you will not produce urine for your spouse.
Right.
Confirm that you have. Another thing is fine. Then we advise you on things that you might be having that you should report to us. If you have back pain, if you have hip pain, if you're having weight loss that you are unaware, if you cannot explain it, quickly come for us to investigate for possible spread that might be causing all that. So we put you on the radar. We monitor you. We keep a close eye on you because of what we have done for you. And the urologists always do that to make sure that they pick any other thing that might come as a result of the cancer.
Right. Okay, Doc, thank you very much. If you had just one message for men listening to us right now, perhaps something they should do today for their prostate health, what would it be?
So let's take charge of our health. Now, social media is everywhere. You go on, in everything, a lot of things. But make sure your doctor is always the doctor. Let's make sure the doctor is the one who makes the final diagnosis who gives us the best treatment option. Let's not go read about things, hear things, and treat ourselves. So when you're having any symptoms, go to your doctor. When you have something you are not clear about, visit your health provider. And then don't sit at home and wait and come to our place.
Right.
It might be too late for you and it might be too late for us as well.
And
right. Let's take our lifestyle. Healthy lifestyle. All right.
All right, Doc. Thank you so much. I'm really grateful that you made time. You were supposed to leave us earlier, but you still added some more time. We're really grateful.
You're welcome.
Okay. All right. Please do enjoy the rest of your day.
Thank you.
All right. Okay. All right. That was Dr. Isaac Mensah. He is a medical practitioner and also an adjunct lecturer at University of Radford, and he made time to join us this morning for a roundtable discussion. And we've spoken extensively about prostate cancer, and now I'm sure you know a thing or two about it. We all have to take it very seriously because we are at risk as men. Anybody at all, as a man, he says that as a man, anybody at all can actually get it, and so you need to be very careful. If you have family history that is associated with that, you may want to pay more attention to that. And also the foods that we eat, the lifestyle that we live is very, very important. Let's all continue. I mean, once in a while, he says that if you have a family history, then every 6 months you need to go check. But if you don't and you are getting closer to your 40s, at least once in a while go do the PSA test to actually look at whether you've gotten it or whether you are getting closer to getting the cancer. And I think that's a very important thing to note. So please, if you miss any part of this interview, it will be on our social media platforms, specifically on our YouTube platform at Z Multimedia. You can go and watch it, take time, and then listen to all the things that we have said in there. So the show continues. We have some little time. I said we're going to call Emmanuel Boateng to wrap up on his presentation on the CPI report that has been released by the Ghana Statistical Service. So we'll get into that shortly in about a minute or two, but let's take a quick breather and we'll be right back.